I don't think governments really should be nudging people to act as they want them to, because not only is that wrong and infringement on the agency of people, but often it leads to unintended consequences.
Hello, world. Welcome to the Vaping Unplugged podcast. Everything you need to know about vaping and tobacco harm reduction.
Welcome back to Vaping Unplugged. I'm Michael from the World Vapers Alliance and very happy to have you with us today. Our guest today is Jacob James Rich. He is a policy analyst at the Reason Foundation, and his work primarily focuses on healthcare policy, specializing in prescription and illegal drug regulation. So a perfect guest for us, and we will discuss the situation in the US and why we ended up where we are at the moment. We talk about paternalism, flavor bans, what are the reasons about the switch in the US from one of the harm reduction leaders to one of the most rigorous fighters against safer nicotine alternatives, and much more. So enjoy the show and vape on as usually. So hello, Jacob. Welcome to Vaping Unplugged, the podcast from the World Vapers Alliance. Thank you so much for joining us today. How are you doing?
Doing good. Thank you so much for inviting me, Michael.
It's our pleasure. We already heard that you're based in the US, so today we will talk a little bit about the situation in the US when it comes to harm reduction. But let's start with the basics. Who are you? What are you working on? And most importantly, why do you do what you do?
Sure. Well, my name's Jacob James Rich. I am a policy analyst at Reason Foundation who focuses on drug policy and healthcare policy. And I'm also a PhD student at the Case Western Reserve University School of Medicine, where I'm studying epidemiology and biostatistics. So what gets me very interested in healthcare policy is that it's one of the few policies that has a lot of government distortions. So trying to analyze what the correct approach isn't very easy. So one policy that is easy to understand, but maybe not easy to implement, is housing policy. Long story short, build more housing, prices go down. And if in general you're pushing for more housing building, you should be doing something that's overall good, right? But in healthcare policy, there's a whole bunch of distortions, and the relationships between various interventions and subsidies is incredibly complex. So it just makes for a very interesting subject matter area to research. And when it comes to pharmaceuticals and illegal drugs, there's all sorts of incentives and motivations for why people use these drugs. And it's not very clear. There's a large intersection of people who might want to use recreationally and or people who want to use for legitimate medical needs. So that's the type of stuff I look into. Overall, does a policy intervention achieve its goal? Policymakers put policies forward and they expect some sort of outcome, which is why they put the policy in effect in the first place. But as people who are more conservative or libertarian minded understand, it's very rare that a policy intervention actually achieves its goal. And I've focused most of my research on whether that actually happens.
That is actually an interesting point, because when it comes to tobacco and nicotine consumption, the solution from a politician's point of view is always very easy. We just need to ban a certain product and then it's gone, right? Oh, sorry, my dog is intervening. That is. It always sounds very, very easy. What do you think about this approach? Does it actually work in the US, or do we need to change something there?
Well, let me give you a specific example. Shortly after COVID, Massachusetts actually put forward a flavored tobacco ban, where they banned all menthol cigarettes, flavored vapes, and other flavored tobacco products. And basic economics would suggest that if you do some sort of intervention, which is similar to prohibition, you're basically increasing the price to consume these goods. So at the surface level, policymakers thought that if they banned flavored tobacco products, more specifically menthol cigarettes, that tobacco use and cigarette use would actually drop. But one thing that they were not anticipating was that the illicit market black market, illegal markets that exist in the United States are incredibly sophisticated, and there's already capital there for them to exist. So once Massachusetts put this ban into place, banning all menthol cigarettes, there was a decrease of menthol cigarette sales in Massachusetts. But if you look at the states that surround Massachusetts, there was a massive increase in sales of menthol cigarettes in the counties that surrounded Massachusetts. And what's pretty interesting is that the increase in those counties outweighed the decrease in cigarette sales in Massachusetts. So the policy intervention was actually followed by a net increase in cigarette sales, which was the exact opposite of what the policymakers intended to accomplish.
That is actually a very interesting point with the existing black market infrastructure. So basically what you are saying is if there is already a black market for certain products, it's more likely that they just take over a newly banned product and just supply it instead of the regulated market. Did you understand that correctly?
Yes, that is an accurate description, but let's make a distinction here real quick. The government can increase the price to consume products. And if the government does successfully increase the price to consume products, you expect use to go down. But something very interesting happened in Massachusetts. Massachusetts has one of the highest cigarette taxes in the United States. So when they banned the product, where illicit market traffickers went was mostly New Hampshire. And New Hampshire had a tax that was less than half the tax of Massachusetts. So by establishing the infrastructure or incentivizing the infrastructure for illicit markets, what policymakers did is they actually made it so people in Massachusetts were buying cigarettes more at the New Hampshire tax, more at the New Hampshire price. So their prohibition in this very unique circumstance actually reduced the price of cigarettes. And that's why use went up. And that's why these markets are so interesting, because they're very complex.
And basically what that shows is that there is a maximum price which is feasible to regulate or put a tax on it. And from a certain point of view, people will just revert to the black market and get the products there. So, but if we consider that, what do you think would be the better strategy for governments who want to reduce a certain consumption of certain products, or do you think that is up to the individual anyways? Or what incentive can federal but also local governments put in place that, let's keep it with tobacco, that tobacco rates or smoking rates go down?
Yeah, so I definitely lean much more liberal in this case. I don't think governments really should be nudging people to act as they want them to, because not only is that wrong and infringement on the agency of people, but often it leads to unintended consequences. So there's a pretty large literature of the effect of cigarette taxes on cigarette consumption. And what we notice is that, yes, cigarette use does go down and cigarette sales do go down when taxes on cigarettes go up. But how those taxes affect people is not necessarily aligned with public health, because although most people are smoking fewer cigarettes, it tends to be the people who are least likely to smoke. So it's not a person who's maybe above the age of 40 or 50 who's been smoking over a pack their entire life that usually reduces their consumption in such a situation. It tends to be maybe a younger person who would occasionally have a couple cigarettes on the weekend with a drink, which is very different. And that type of consumption is nowhere near as dangerous as consuming about a pack a day. So what these taxes end up doing is that they reduce use among the people who don't need their use reduced the most. I hope that sentence made sense. But where they're actually focusing their harm are on people who are most addicted and least likely to reduce their use. And if you quadruple a cigarette tax, as many states have done over the past few decades, then all of that money you're taking from people happens to be the people who are most addicted. And oftentimes those are the people who have the least amount of money. So it ends up the government, profiting off of the addiction of people who really don't have the ability to stop. And you just end up extracting money from society's most vulnerable populations.
Yeah, and I think it's very interesting because when it comes to tobacco or cigarettes, we are used to decades of government interventions, and then the market or consumers basically came up with the actual most effective nudge, namely a less harmful alternative. So I would argue that the minimum what governments need to do is not to regulate those less harmful alternatives more extensively than the existing more harmful cigarettes. Or even better to regulate and tax it risk-based so that the less harmful alternatives are cheaper than the others. But in reality, unfortunately, we don't see that really. And for me, when I look at the US as a whole, it's always a little bit of a sad story because it used to be one of the harm reduction leaders. And then within a couple of years, we saw this, I would call it war on nicotine, morphing from let's reduce harm from cigarettes to let's eliminate nicotine consumption. When did this shift come about, or what was the reason for that? Do you have any explanation for that?
Yeah. So in 2009, President Obama signed the Tobacco Control Act, which gave giant regulatory authority over regulating tobacco products to the Food and Drug Administration, which is our FDA and is one of the most powerful agencies in the United States executive branch. So what ended up happening in 2016 is that the FDA was able to successfully deem e-cigarettes tobacco products. So as we know, e-cigarettes don't technically contain tobacco, and they aren't really technically tobacco products, although they are definitely nicotine products. But the FDA was able to convince the United States courts that for all intents and purposes, when Congress gave them the power to regulate tobacco products, it was basically assumed that they would be able to regulate anything that contained nicotine. Like that was the general intention of the congressional legislation, which is probably correct. But regardless, after FDA began regulating regulating vaping products specifically, that's when everything basically started to collapse because they were able to hold American companies accountable for the vast amount of regulations they put forward. But many of the e-cigarettes that are sold in the United States, especially now, are actually completely illegal and have no American footprint in terms of like corporations that you can hold accountable. So basically what the FDA did is it turned the entire e-cigarette market in the United States to an illicit market, just full of illegal products that are not able to be regulated. And that's basically what we're dealing with right now. The FDA doesn't have the law enforcement personnel to enforce its own rules. So you basically just have a situation where companies that can be held accountable aren't allowed to participate in the market. And then you just have a whole bunch of brick and mortar black market products that are probably with about 90% of e-cigarette users at the moment.
Yeah, and what is always confusing from the outside as well is I think it was a bit unfortunate that at the same time this moral panic about nicotine in general exploded in the US. It's always, I think that's a typical US thing for me, this moms against something. And for some reason they are always hurt, but not the 30-year-long grandpa who was smoker and switched to vaping. They don't have the voice. So it was probably a combination of those two things, because I also think the attitude in general society changed, and also the media outrage with Evali and those kind of things. Do you think that played also a role, that some politicians just jumped on the bandwagon and thought, okay, this will guarantee me re-election or votes or something like that?
Yeah, there was definitely some intentional and definitely intentional lying on the part of many policymakers. because when EVALI began to erupt in 2019, the CDC had the data to understand immediately that these lung injuries were not caused by nicotine vaporizers. They basically only existed in states that did not have regulated recreational marijuana markets. And when you looked at the testimonies of the victims of all the lung injuries that were caused by the alleged vaping products, basically every single person who had an injury said that they used marijuana vaporizers. And then there was basically no examples of people who only used nicotine vaporizers that cause these injuries. So I hate to say this because in general, I like to assume good faith among people. But in this circumstance, it seems like it was intentional to blur the lines of marijuana vaporizers versus nicotine vaporizers in order to motivate additional regulation of nicotine vaporizers, even though they had absolutely no effect on the lung injuries that were being reported in 2019. And still to this day, if you go to various hospital websites that have a large effect on policy, such as like the Mayo Clinic or the Cleveland Clinic, you can definitely find articles that are still posted discussing EVALI and how EVALI can be caused by nicotine vaporizers when it's absolutely untrue. It actually required a data analysis by me and Jeffrey Myron at Cato and Harvard before anyone would actually start challenging the claims of the CDC at the time. And then the CDC ended up recognizing a study that basically copied our results in JANA Network Open. But by that time, the EVALI episode had already caused lots of misinformation because it had been raging for about a year. And there was about a year of misinformation going around about what exactly was causing these lung injuries. But long story short, the FDA was able to deem nicotine vaporizers as tobacco products in 2016. And then the scaremongering in 2019 basically gave them the political power in order to further enforce regulations, which brought out all of the mothers groups and prohibition groups that have created the situation that we have today.
And you mentioned a couple of health institutions. And if we look at the health sector in general, it's very astonishing because if we look to the UK,
they're anti-health, aren't they? It's really interesting.
Yeah, and if we compare it to the similar, or I don't know how to call that, sister organizations in the UK, for example, we see completely different messages. And in the UK, it's quite normal that every health institution says, hey, if you can't quit smoking, switch to vaping, it's less harmful. Those kind of factual messages, which I think smokers should know. But in the US, we see the completely opposite. Do you have any explanation for that? Why that is? Also with the health institutions, where I'm always with my naive thought, where I'm thinking they want to actually tell people the truth?
That is a great question. I'm not exactly sure what the motivations and incentives are in the United States to promote public health interventions that objectively make people less healthy. And it's really sad because, as you brought up the United Kingdom has really doubled down on trying to increase access to e-cigarettes among people who smoke. And the best example of this is pregnant mothers. The United Kingdom is actually identifying mothers who become pregnant, or future mothers, and if they are unable to quit smoking, they often provide e-cigarettes and vaping products to them for free. And the reason this is because the outcomes for children among mothers who smoked during pregnancy versus using e-cigarettes during pregnancy is astonishing, because the children who come from mothers who completely switch to e-cigarettes, their children are almost indistinguishable from children from mothers who have never smoked in their lives, versus the mothers who don't quit smoking. there are lots of health problems associated with those children. So the United Kingdom has seen very blatant evidence of the benefits of convincing people to switch to e-cigarettes if they are unable to just completely cessate from tobacco and smoking in general. It's very obvious how much less risky the e-cigarette products are compared to cigarettes in all sorts of different ways. Why the United States is not pushing this forward, I'm speculating here. I'm gonna spitball a little bit, but it could be because the United Kingdom has a completely socialized healthcare system. And this isn't me saying that socialized healthcare is better than non-socialized healthcare, because I don't believe that at all. But at least the incentives in this system are to reduce cost. And if they can do something that's relatively cheap, aka provide e-cigarettes instead of regular cigarettes, and reduce the cost for their system, you actually have the system's incentives aligned so that people become healthier. What a major problem is in the United States is that we don't really have a capitalist system. We have like a quasi-capitalist, quasi-socialist system. And there's like 3 different types of socialized medicine that you might qualify for in the United States. Or if you're employed and below the age of 65, then you have like private insurance that's highly regulated by CMS and the Affordable Care Act. So none of these, because there are so many different types of coverage in the United States, and because people often switch coverage as they get older, there's no long-term incentive for the system to keep you healthy, because they might as well just bounce you to a different provider once you reach the age that's actually expensive. And one thing we should probably keep in mind is that, at least in the United States, and maybe it's the United Kingdom too, but at least in the United States, in terms of cost to the government, smokers actually save the government money. And that's because they die, and they die earlier. So in the United States, you qualify for Social Security, I think around like age 62 or whatnot. And you actually, if smokers end up dying approximately like 10 years earlier than normal people. So you have to think like, what's more expensive, giving someone Social Security benefits and Medicare benefits for 10 additional years, or basically letting someone die of a heart attack, and then that death taking this person out so that the government doesn't have to give them money in the long run. So I kind of just explained a whole bunch of different like various incentives. I'm not exactly sure how these actually affect the specific outcome you want to discuss, but the United States is overly complicated in its welfare programs and its healthcare. And I think that complication is why the incentives don't always align with being healthy.
Yeah, and it's very interesting because I think sometimes we tend to only listen to the little bit oversimplified explanation, or they are all ideologists and they hate pleasure or fun. And that's probably part of the story with some people, but hopefully can't be for the whole system in general.
Well, yeah, so that wouldn't explain the systemic problem. And the United States has a systemic problem. So I think it's clearly an issue of a misalignment of incentives. That's probably what's happening. But I tell you what, if people like you and I actually want to change the system, we have to better identify what that mismatch of incentives is so we can intervene and fix it.
And the other thing is no success is guaranteed, even in the United Kingdom. We see now that they are coming for more regulation now, especially because of the disposables. And I think with the disposables, we can have a look a little bit, an outlook in the US, because some people say we have this disposable thanks to the flavor ban, which President Trump implemented for the pod system. So companies had to switch. Now he's running again against Kamala Harris. So do you think from a harm reduction perspective, it makes any difference who will win, or does that not matter, or is it not clear yet?
It will make a difference because both of the candidates have different approaches, right? So I think under a Harris administration, you will run into a situation where the FDA will be given more power, and you're going to run into you're going to reduce access to e-cigarette products and other harm reduction devices with Kamala Harris taking over. I think that's clear. What's not clear is what happens with Trump, because he's positioning himself as a pro-nicotine candidate, and he has publicly stated that people who vape should vote for him because he's going to make sure that they have access to their products. But like you just mentioned, he's the one who pushed forward the flavor ban on pod systems. So I'd say that Kamala Harris will definitely reduce will reduce access to these products, and President Trump is a wild card, like he is with so many other issues.
So it's very safe to say both are not the ideology or the super convinced harm reduction advocates we wish one of them would be.
They're not.
And probably will also depend a little bit on the outside pressure which comes to them. And I think that is the interesting thing about the US as well, that people actually sometimes have the chance to influence that when they are loud enough. And maybe that would be my last question. I know that's not your turf, but since we represent consumers, do you have any suggestions what consumers could do to better the situation or to influence policies in the future?
That's a great question. You're right. That's not what I do. So let me take a couple seconds to think about it. I think one of the biggest groups of misinformed people on this topic is actual doctors. So if consumers have relationships with physicians who are friends, or more importantly, the physicians they see for their primary care, I would encourage them to go out of their way to educate doctors on why e-cigarettes are considered harm reduction compared to combustible tobacco products. And when they present doctors with this argument, they should go there with all of the academic literature that shows this. This isn't like everything that I'm discussing right now is not a like big tobacco conspiracy of tobacco funded research showing that these products are safer. These are scientists who don't use these products, who have no financial stake in these products, actually coming out and publishing in the top journals like The Lancet, JAMA, New England Journal of Medicine. All of the top journals show clear harm reduction from people making the decision to switch from combustible products to reduced risk e-cigarettes. And if you want to find a good place where a lot of this information is consolidated, I just wrote a piece for the Journal of Free Speech Law with Jonathan Adler, and it discusses why e-cigarette manufacturers should have better protections of First Amendment free speech rights. But throughout that entire piece, we actually detail the literature on the relative harms of both products. So there's a lot of good scientific literature that's cited there. And I think if people want to know more about the scientific literature as it relates to harm reduction, our piece would be a very good place to start.
We can definitely link that in the show notes. That's no problem, and very interesting. When we are already there, maybe at the end you tell people where can they find you best, how can they reach out to you, where are you active, what's the best way to get in contact?
Yeah, there's two ways. If you just want to have a public conversation, I'm pretty active on Twitter, aka x.com. So just at Jacob James Rich, exactly as it sounds. And then if you have an inquiry that we'd like to keep a little bit more private, you can definitely email my Reason email, which is jacob.rich@reason.org. Feel free to provide the spellings of those in the show notes if you like.
We will. Yeah, then thank you so much, Jacob. That was very intense and interesting. Very nice overview, I think, over the most pressing issues in the United States, and hopefully interesting for the international audience as well. I highly recommend everyone to follow Jacob. Very interesting on X, actually. I always say Twitter too. Thank you for joining us again. It was a pleasure, and all the best to you.
Thank you so much for inviting me, Michael. It was a pleasure.